we'll get started. I'm going to share my screen. And we've got the agenda. Coming along. So I can do, I'm asking everybody to be a little bit more patient with us today because we are short a staff person, which does some of the Zoom magic. I did just stop sharing my screen. So I did that on purpose because I need to just do one quick thing. Lindy, you should be able to do breakout rooms now. I just made you the host. Okay, cool.
I
Perfect.
can, thank you.
Okay, great. So back to regularly scheduled programming. So, you know, both the members of the public that are here and folks that have been recruited to participate on the task force, thank you for joining us. We really value your time. It's wonderful that there is blue sky out. That is very different than the last month we've been dealing with because we were in the beginnings of that awful smoke and, you know, fire emergency when we were together a month ago. So we're going to welcome some new folks this morning that this is their first meeting. They haven't been able to, they haven't joined us before and haven't had a chance to properly introduce themselves. So I did want to, I'm going to put my predecessor's predecessor. She's participated before, but actually I was hoping Linda would introduce herself and talk about how she's helping to lead broadband. Ken Mintz, this is your first meeting. And as I look at other folks, Heather Fontanella, did you get to introduce yourself properly last time, Heather? You did. Okay, that's what I thought. Leslie, have you been able to introduce yourself? Okay, so you're going to go third. And as I look at everybody, I think that's it. So, Linda, you're up. Uh-oh, you're muted, Linda. Can you unmute yourself?
Thank you.
Okay, cool. Perfect.
Yes, I'm really pleased to be able to participate in this effort. I've been pretty active with broadband issues and was head of the East Bay Broadband Consortium for several years until the CPUC funding went away. But clearly broadband access is very critical to our communities. And so I'm really excited to be able to help in whatever way I can to make that happen.
Great. And speaking of broadband, Ken Mintz.
Yeah, good morning. Thank you, Kristen. Yeah, my day job is with AT&T. I'm the External Affairs Director here in Contra Costa County. Been involved with telecommunications for 40 years. In addition to my work with AT&T, and I'm hoping I can be a contributor to the broadband discussion, I'm also the chair of the East Bay Leadership Council and on the school board for Sangamon Valley Unified School District. Thank
yes,
you.
Lots of different hats to be worn, as many of us do as well. So now to Leslie.
Well, good morning. It's so exciting to see faces. It feels like a luxury these days. Anyhow, I'm Leslie Choi. I'm the Executive Director of the San Pablo Economic Development Corporation. We do a lot of work here in the county and a little bit also in Northern Alameda County. And so there are a lot of our partners here on these calls. Or Ken Mintz, who's one of the first people I met when I started this job in late 2012. So it's just nice to be a part of this, especially given the small businesses and folks we have in West County and the importance of an equitable approach. So I'm excited about this work.
Okay, great. I'm going to go ahead and share my screen again. I wanted to, because we do have an agenda, which I only sent out this morning. And so, but just wanted to kind of cover what we're going to hope to get to today. Oh, let's see. Lindy, I need you to make me a co-host again because I can't share my screen. But what we hope to do just to cover the agenda today is to continue the progress we're making. We're going to start off with just a little economic update about what what's been going on since our last meeting in terms of unemployment and economic vulnerability of small business. You know, there are competing schools of thought around how badly the sky is falling, but I'm very skeptical of those who are like, it's just a really bit of a blip, because I'm seeing major changes and big layoffs and so much, and to me, there's just such a disproportionate impact on in certain communities. And so we're going to talk about the economic data a little bit. Then we're just going to review just the established goals of this task force and take a poll as a large group to help us guide some of the work, because the hope is that this task force will help inform. We're going to be doing 3 webinars for impacted people and a couple of half-day convenings. And so we're hoping to really harness the brain power in this group to help guide that. And then we're going to launch, and then we're going to go into our breakout sessions. So we're going to, again, and you know, these 5 groups came out of some of the initial discussions in the first couple meetings. We're not going to stay in these until June. This is kind of what we're doing right now and get to action. And the idea is that some of these groups will continue to meet. Some of these small groups will be done, and we're going to listen to the groups, and you're going to help us guide that. And you know, I really want you to have a point of view about whether or not you think that this is robust, or if we've identified some actions and can move on. Because, for example, you know, the broadband group in their first meeting got pretty deep in terms of what's going on, what are some actions, here we go. And so they might be on a different time frame than, let's say, the group that's kind of wrestling with how can we get new employers to participate in this work. So I am able to share my screen. So as you see this agenda, so we're hoping to get to the breakout groups relatively soon. So because I'm already behind and haven't done the economic update. So we'll just dive in. So in terms of an economic overview, so the latest available public data does point to strong, that housing is going to be a strong force for recovery, and even some moderate manufacturing growth in the last month. But consumption gains look to be losing momentum, and there could be a variety of reasons for that. It could be really that there are so many people that have lost work that they can't consume, and that they are, and that is really a drag on the economy, in addition to the human toll that causes. If you look at the retail sales report for August, it showed that there are some segments, and it makes sense, right? Building and garden supply, people are at home, they're at record highs and growing, but apparel remains very weak. And this is a chart of that shows US retail and food service. So you can see, right, the big dip and then a big recovery, but it's still, you know, down compared to what it was. And it, you know, is somewhat volatile. And you can note the real drop in 2008. You know, again, this dip took us further down than that recession. In looking at the California unemployment picture, you did see a decline compared to August, or compared to July for the August data. And obviously that's positive, but for anybody who's paying attention to the details on this, there is a lot of census workers that are included in this that impacted things nationally, as well as specifically here in California. But we did make some progress in California as well, or in Contra Costa. So, right, so we're looking at a rate of 9.8% unemployment, which is down compared to where we were at last time. And so, you know, it's a far cry from where we were pre-pandemic, but so some of the initial worst case scenarios, we're not seeing that yet, but it doesn't mean that we shouldn't be preparing for what could be much worse. So that's just something to keep in mind. So then to this point about, and I just wanted to thank Donna for highlighting this particular article. There's some work done by John Kabatek from NFIB, which is, you know, represents small businesses and has been working on California issues for 2 decades. There's an article by him in Forbes this week that talks about, there's an article in Forbes that talks about some of his work, highlighting the impact of what's happening with small businesses in California. So this slide talks about the number of how the revenue has been impacted, and then the number of open small businesses. And so, Elisa Friedman saw a stat about maybe 1 in 100 small businesses being permanently closed. And granted, permanently closed is different than whether or not they happen to be open right now. But I do think that there is there's a big problem. And obviously this can be a lot of personal care businesses. This can be some of the businesses that are impacted by the public health orders that can't be open, but this deep into the pandemic, it's not hard to imagine that number will convert to permanently closed without some interventions. And that while there was a small business tax credit that we were happy to promote and want to make sure everybody takes advantage of, that was passed by the legislature, there were things that didn't happen. Most significantly, some liability protections for employers related to potential COVID-19 exposure in the workplace. And so, in the sense of, for employers that are trying to protect their workers and trying to do the right thing, want to make sure that they are protected. Obviously, there are concerns around not protecting workers and where employers fell short there, but having some attention to the liability, I think, is something that we're going to want to keep an eye on as a group, and thinking about how we can impact those decisions at the state level. So I will stop sharing my screen for a minute and just see if anybody has any questions. And good question. Do the employment numbers include or reflect those who are undocumented? No, I do not think that they do. But actually, it's more of a question of formal or informal part of the economy. So there very well could be undocumented members that are in formal employment arrangements and are captured, but I think it's generally understood that those numbers are significantly undercounted in those statistics. And then I did, and Vic makes a great point about the difference right now that Alameda has moved into the red tier from the purple. Contra Costa remains in the purple tier, although trends are pointing in the right direction. But that is a link to, it is frustrating that Contra Costa remains kind of in the back of the recovery in the Bay Area, because those tiers are triggered, just, connected to so many other things, including reopening of schools. And so, which has so many important impacts for families and the economy. So, so great points. And we can do some follow-up about the statistics related to, people who are undocumented and how that is reflected in the unemployment numbers. Again, as you recall, at previous meetings, we talked about how the state predicted that unemployment would hit 20 to 25% by the end of the year, which is just sort of shocking depression level unemployment figures. And so it is good to see that at the state level, we're not getting anywhere near that. And hopefully we can avoid that scenario. And good question around work participation rates. It's interesting. This probably isn't where you wanted to go with this question, but I did appreciate that the Federal Reserve of Bank of San Francisco put out a piece, and we'll put it up on our resources page for the task force, that they analyzed the impact on choice to go to work of the $600 supplemental federal payment, and found that it did not serve as a deterrent for people choosing to go back to work and choosing to participate, because if people have a choice between long-term, steady, meaningful employment, they're going to choose that in terms of choosing to participate. So I think that worker participation, it's really important. And I think it's helpful from a policy standpoint that we kind of break down some of those myths, right? And it's worth noting at this particular point in our meeting that bipartisanship did break out on Capitol Hill in Washington yesterday to pass a continuing resolution on the House side, which is anticipated to be passed in the Senate and signed by the president in order to keep the government open to avoid a shutdown. That included $8 billion in supplemental food assistance for kids. That was some of the, and as well as some restocking of what's supposed to be a loan fund, but some people are criticizing the president is using it as a slush fund, but take it as it is. But it was important for both Democratic and Republican members representing rural districts to get that done for farmers who've been impacted by the trade. So that included, so it's essentially a clean continuing resolution except those two pieces, which means it does not contain meaningful federal stimulus, right? This package that we've been waiting for a couple of months, because you have both the chairman of the Federal Reserve, Jerome Powell, and other key economists. Who is the other person that said? Oh, and the Treasury Secretary. It's the Treasury Secretary and Jerome Powell agree that in order to avoid a deep recession, we need federal stimulus. And so that still hasn't happened. So yeah, and I appreciate, Pam putting it in the chat, the story about the impacts of the closures on small businesses locally. So, and then of course, with the impact of a Supreme Court vacancy and what is happening on the Hill, I am not very hopeful about what else might break out. But, if we could get that federal stimulus that could help our local jurisdictions and do the things that we've talked about before, that would be great. Because as Elisa points out, we still can't print money in the state of California. Okay, if there aren't any other questions, I will go ahead and we'll move on to the next piece of the agenda, which is just to, let me start sharing my screen again. See, I'm not as smooth as Mark is. See, you're going to appreciate this next month when he's on the other side of jury duty. So, so just to sort of talk about, and we haven't set specific measurable pieces around this, but the overall task force goals are to align existing efforts, right? And make sure that we're not spinning our reels unnecessarily and that we're really trying to create some synergies that make a difference. We're going to track and guide actions to support job creation, identify and promote policies to attract and retain employers, identify and promote policies that increase access to employment and expand connections to training and employment for those disproportionately impacted by the COVID-19 pandemic. This is our wheelhouse, okay? And over the next couple of meetings, we're going to go ahead and come up with some specific metrics, and there's a couple of great folks on the in the Employment and Human Services Department that are going to help us create our evaluation plan for this work, and we're grateful for that. But we did want to just use this time to go ahead and do the part of what we're supposed to do is have this task force advise a couple other strands of the work that I mentioned earlier. So I would love it if, I think it's probably time to have Lindy, you launch our poll. Can we do that? Because we wanted to take a poll to get your perspective on what we should be focusing on in terms of our first set of webinars. And so, Lindy, did you want to introduce it as you launch it?
Absolutely. So please, if you can, just take a moment to read through all of these and give us some sense of what you think would be good potential webinar topics. Ideally, please pick 2 or 3, though of course, if you feel like all 5 or just would be so great, you can't help yourself, we understand. You do have the option to vote for more than 1.
So stand by and we'll get that launched.
Thank you. We've got about 60% return, so we'll give it maybe another few seconds. Oh, we're up to 82. Vic, I'm seeing that the survey is not showing for you. I'll send it to you separately. Thank you for letting me know. Okay, thank you, everyone.
Okay, so that is going to be helpful as it guides our work, and we'll report back. We'll report back on those findings, and we're just having one more person join right now to the large group. So we're going to head into the 5 breakout groups. I'm going to start sharing my screen again, which will show you what these 5 groups are. And we've kind of tweaked the names of them. So funding priorities to support Contra Costa's economic recovery, improving broadband access, hiring displaced workers through wage subsidies, growing and supporting Contra Costa's industrial base, and growing the local healthcare workforce. So those are the 5 groups. In terms of what we want to have you thinking about, these are your prompts. So we're going to make sure, so what's going to happen when we break off is that you're going to go into a small group. And if this is your first meeting, we're going to put you in a small group. If you gave us a preference, we tried to honor that. So we're going to identify a facilitator and a note taker. Now the note takers, we have pre-assigned note takers to make sure that task is covered, and they can also facilitate if need be. The idea is to share and recap since your last meeting. And so in some groups, there's written notes of that. In other places, there are not. But we're going to try to go a little bit deeper and a launching off point from some of the things that you identified. Then we're going to, if relevant, we're going to identify what information you need in order to guide this work. And that's what we're going to, as a team, work on between now and our next meeting. And then we want you to consider, would it be worthwhile to meet again as a small group during our next task force meeting? And if so, what's the next question to answer? Because we do want to make sure that this is staying fresh in everyone's mind. So those are the prompts. I'm going to go ahead and put this in the chat as well. And so what's going to happen is we're going to stay in these groups until about 9:45 or 9:50 actually. So we'll spend 25 minutes in the small groups tackling these things. And then we're going to come back, and if we have a couple of volunteers that want to share what happened in your small group, we'll appreciate that and do a recap. But then we do want all the note takers to email their notes to Laura so that we can create a more robust record that we can be sharing with you between meetings. So again, this whole process is a work in progress. So I'm going to go ahead and stop sharing, and Lindy is going to start zooming. Everybody to their small groups, and just try to be patient. Thanks, everybody. And the one step is you have to accept your assignment. So then you'll start going into your small groups.
Hi all. Kristen, I actually had this one stay the healthcare work group. That way I would be able to open and close the groups
Perfect.
from here.
Perfect.
What room would you like me to put you in?
Put me in the priorities for funding.
Okay, that's what I thought, but just wanted to, hold on one second.
And then you should put Elisa in broadband, if that's okay.
All
Or
right.
do you want to stay here?
No, I want to stay here. Linda's
Okay,
covering broadband for us.
Okay,
I'm interested in broadband, but I'm also very interested.
Okay,
in
cool. Okay, perfect.
Thanks.
Hold on one second, Kristen. I just need to assign you to. There you go.
All right.
All right. Hello, everyone. Thank you. As you can probably imagine, I'm your assigned note taker, as I was last time. So for those of you who weren't with us last time, if you wouldn't mind introducing yourselves, or maybe we can just all go around and introduce ourselves really quickly again. I think that's always a good practice. Since I have the fun Brady Bunch and we're all in a different square for everybody's screen, if it's okay with you, I'm just going to call on people one by one, starting with Heather.
Good morning, everyone. My name is Heather Fontanilla, and I am the administrator in charge of our Career Pathway program at Mount Diablo Unified School District. You're on mute, Lindy.
Yeah, I saw that. Sorry about that. Thank you, Heather. Tamika, could you go next? Also, Tamika, if you want to be in a different group, let me know. I just didn't have a pre-assigned group for you.
Okay, I wasn't here for the last two. My name is Tamika Greenwood. I'm the Government and Community Relations Manager for Sutter Health, and I cover all of their East Bay and San Francisco hospitals. Good morning.
Excuse me, Lindy, can you hear me?
Yes, I can.
Hi, this is Maura Connell, sorry, but I'm actually supposed to be in the industrial base.
All right, thank you, Maura. I couldn't see you and all it said was Connell, so I wasn't sure, but you should be assigned there now. All right, and there we lost her. Okay, Robert, would you like to go next? Oh, you know what? You are muted. Let me unmute you.
How's that?
Perfect.
All right, my name is Robert Duncan. I'm with Rubicon.
Oh, he muted himself again. Robert, you muted yourself. Nope, we still can't hear you, Robert. Sorry. Okay.
Are we there?
Yes, now we can hear you.
Can you?
Yep, we can hear you.
Okay. What do you guys got my name and everything, right?
Robert, and you're with Rubicon.
Yeah.
Thanks, Robert. Brian, why don't you go next?
Sure. Brian Cook, Associate Vice President at Cal State East Bay, and I'm responsible for our Concord campus, our downtown Oakland Center, continuing education, and international programs for the university. Thank you.
And have a very cool background today. It's a beautiful building. Okay, Alejandra, do you want to go next?
Yes, Alejandra Chamberlain with the Contra Costa County Office of Education, representing Superintendent Lynn Mackey.
Thanks, Alejandra. And then, of course, definitely not least, but unfortunately last. Alyssa, you want to go?
Thanks, Lindy. I'm Elisa Friedman, President CEO of Opportunity Junction, and excited to be here because we are working on increasing the number of certified nursing assistants we can train.
Yes, you are. Important work. Thank you. So thank you all for being here. I hope to mostly provide room. Hi, Kristen, you came back. Oh, you're muted.
Hi, Lindsay. Thank you for sending me that email. So did you want to be put in the industrial group?
Yes, please.
Okay, cool.
Yeah,
cool.
I didn't mean to exit. It just shut down.
No problem. No problem. So can you make that happen, Lindy?
Yep, right now.
Thank you so much.
Of course. Okay, Kristen, I'll put you back, or can you go back by yourself?
I don't think I can go back by myself, sadly. You are all powerful. Unless, oh wait, I can go back. See?
Okay, well, I appreciate you all being the group that also is in charge of dealing with the technical issues here, so thank you. So last time we talked a lot, I think, about kind of the landscape. We did a little bit of a discussion about some of the major barriers that we have around developing a healthcare workforce here in Contra Costa County. I'm hoping today we can spend a little bit more time on opportunities and kind of thinking about what information we feel like we need to make possibly some recommendations about things that could happen here within Contra Costa County. Perhaps those would be policy recommendations, perhaps they're recommendations for further support. I don't have any presumptions about exactly what those recommendations might form into, but I do want to talk to all of you about what information you think might best be able to inform your work. And because I recognize that's a broad question, I'm going to start out with one that I have. I know that Futuro Health, which you all might be familiar with, is an initiative that Kaiser has started in partnership with one of their labor unions, has recently been sending out information about the possibility of online training for medical assistants to do telehealth. And I found that to be pretty interesting. I thought, well, if we had a community college program or Cal City East Bay program or something similar, perhaps even an Opportunity Junction program that was really concentrating in training for telehealth, is that something people might be able to see as an entrance into the medical field, but without necessarily the same training that would be required for, let's say, like an LPN program? And it made me interested to know, is this an area where we think the county and some of our major healthcare providers like Sutter and Kaiser might be looking to hire more in the next, let's say, 5 years, just knowing that telehealth is somewhat of a growing field? and whether or not that's something they're going to be looking towards MAs for or CNAs for, or kind of what they're thinking their HR requirements are going to be in that regard. So that's a question I have. And I kind of thought that might be a place to start as we think about what questions we might have. I also want to throw out there, if we think it's useful, we might be able to put some of those questions into a survey to send to, let's say, like HR reps at some of our local healthcare providers or even the county themselves, to give us some context and better understanding about where we might see gaps in what we know now. I just talked a lot, so I'm gonna open it up.
I'll respond. I don't know a lot about the initiative, and I will say that my opinions are coming from my GR lens. Have never been clinical, but I do know that in the future of medicine, there are a lot of changes and things that are going to be happening in terms of telehealth, and a lot of the hospitals are going in that direction, just for various reasons, partially now out of necessity, but also I think that's just where the change is going. I don't know in terms of training. I know one of the issues I've dealt with in the hospitals, that there has been an issue of training and properly training some of the nurses who are not RNs. And so I would also be interested to know if there is, are you thinking multiple levels of training? Because we are, part of the problem is we're having some of the people in the SNFs, the level of training is not quite there. So I'm wondering if that would be different for telehealth, or there's a different component to it, but I'm thinking just the telehealth training probably, in my opinion, would not be something we would be looking at this point, just because of with everything going on, we need I don't know, it's a higher level of training, I would think. And that's my opinion from just working in the field with the electeds. That's one of the issues that we've had. And Alyssa, I'm not sure if that's something that you are aware of, but we are.
You are.
But we are hearing just the level of training for the nurses and the SNFs and the.
Yeah. I think there's like two questions, which is what is a good platform for training people for either in-person or telehealth? And then do we see telehealth being a larger part of some portion of the healthcare system in the future? And I think the answer to that second question is, I think, yes, right? But whether a medical assistant trained virtually, I mean, I don't think you can train a medical assistant entirely virtually without some hands-on. It might just be my old brain, but I feel like there's a certain amount of experience working with people that would inform your advice in a telehealth situation. I mean, otherwise you could just have a computer doing it. I think it feels like to me. So I think that the Futuro initiative, Lindy, that you're talking about, that will work for a certain segment of interested, motivated, kind of healthcare, folks who want to start healthcare careers, and it won't work. I don't think it'll work for everybody. We'll have like broadband access issues, but also just some people do not learn as well online. And so I do think, especially if you're trying to teach care and, kind of person-centered care, those kinds of things, maybe you can learn the curriculum, but there is a certain amount of interaction that I think is needed. Not to say that what they're doing isn't valuable at some level. Sorry.
I mean, even outside of telehealth, just in general, what kind of questions do you think you all feel like you have that might help to inform the work we're doing here in regards to thinking about how we might grow a healthcare workforce here in Contra Costa County, especially concentrating on kind of entry-level points, recognizing that there is an equity component of this work and that not everyone might be in a place to begin an RN program.
Can I speak to that?
Yeah.
That's one of the barriers that I think we should be thinking about addressing, which is that the healthcare career pathway, if you think about sort of the most entry-level spots, which are either sort of certified nursing assistant or MA training, medical assistant training, and then going up to LVN and RN, it is not put together as like stackable certificates. If you train to be a CNA, that does not translate to an MA, which is a higher paying position within the hospitals. And so I've heard that described as a broken career path or a myth or whatever. This is a big thing for a county or, countywide thing to try to address. But if we could create modules that stack so that you can move from one to the other, I think that would be really valuable.
I will just chime in and say I agree with that. In San Francisco, I'm sure you all know, there's the development agreement, and one part of that agreement has been ensuring that we hire locally. And one of the issues we have absolutely paired with local organizations within the cities, but some of the issues have been training a person for different roles within the hospital is not the same as training someone for a role in a tech company or their HIPAA laws and other things. So I absolutely agree with you, Alyssa, on having maybe modules that will give you a continuum of buildup so that you are able to move forward and you don't have to jump out of one career in your path of knowledge and then go into something completely different. You can continue to move up. So I think that's a great idea, because we're facing that in all the hospitals where we want to hire, but there's just a certain level of training that you maybe, if you are in operations or janitorial services, you don't receive from your previous job that you would need to have in a hospital.
I can just speak from looking at it from a high school perspective, and the students that we serve at some of our highest need schools, that what you're talking about does definitely create barriers to our students in moving up on the career ladder. They start off, getting their, becoming a certificated nurse's aide. But the problem is that oftentimes the costs associated with that are super high, and the wage that they're making is not sufficient. So they struggle to pay off those costs. And so for them, for a lot of these students, the idea of going on in their education is not an appealing one, because they're struggling to pay off the education that they got or they received to get their CNA. So looking at it from that perspective, I think, and as educators, we have to do a better job of teaching students the value of stackable certificates. But it doesn't seem like in the healthcare pathways, it's as easy to do as in some of the other industry sectors.
Along with that, I would say that that's why we lose many of our young youth or young adults to these quick jobs like working for Uber or going and working for Amazon, because they could, or security, because they can make more and they don't have to do all the training. So until the community really speaks to hiring locally and at risk, and who does that mean, and tailoring and being very mindful, it's going to continue to be an issue. I mean, Heather, Opportunity Junction, Contra Costa County Office of Ed, Mount D, we've been doing and supporting young people for many years, and it hasn't changed.
And I have to say too, in relation to that, one of the initiatives that we've been working on in the educational system is trying to align what's happening at the K-12 system to, say, the community college system, and healthcare is the hardest one for us to break into. So just as an example, I have a teacher that teaches a medical terminology class at the high school level. He also teaches medical terminology at a community college, but the community college will not allow the students at the high school level to get that college credit, even though it's the exact same teacher, because their impression is that the high school students are not qualified, they're not mature enough to take a college level course. And so for students, that we serve, the at-risk students, high need students, the idea I have to go to school and take the same course that I just took in high school is very frustrating to them. And so opening up the opportunity to align the high school courses that are similar to courses they would take to get their CNA or other types of certificates, I think is a huge step in increasing equitable access to these careers.
That's a great point, and I definitely will highlight that as a potential point of advocacy as we do think about something that might be actionable coming out of this. Heather, I imagine that's a conversation, and I know you and I have talked about this briefly as well, but that's a conversation really that you've tried to have with the community college themselves, right?
Yeah.
Okay. Just wanting to confirm that from my notes. That's a decision. Listen.
Who are the decision makers in that respect? Like where is the advocacy needed? Is it with the individual community college? Is it with the state regulatory system? I don't know, Brian, you can speak for the higher education.
Yeah, it's both. I think it's both. And yeah, I think one of the things that came to mind for me is a lot of this has to do with the accrediting bodies, right? And so there is, and I think that's a component that we will all be addressing is, in a time of crisis, I think we need to push on policy to make sure that we're meeting the needs of our constituents. And if we need to open things up and make things more accessible or more flexible. And, right now we're still in a particular system where if you don't have straight A's and perfect scores, you're not getting into our nursing program. And so it's like, it's either all or nothing. And that's not the right message that we want, and it's like for individuals who think they're going into a nursing program and all of a sudden it's just like change your major or leave, right? And that's just the wrong message. We need to fix that. One of the things, and Lindy, post meeting, I'll find it and send it to you. There's this interesting sort of opportunity with labor market data, and it's kind of like matching the inputs and outputs. The University of Hawaii's community college, public community colleges, and four-year institutions are all under the same sort of administration, which is not the same, obviously, in California. And so what they've done is they've partnered with, comparable Bureau of Labor Statistics type data infrastructure, where essentially if you're an individual and you go in and say, all right, here are the courses that I've taken, here are the certifications that I have on one side, and then on the other side are all the jobs that are available. And it connects and says what's missing, what certificate's missing, what degree is missing, what courses are missing. And if you take X, Y, and Z courses, you'll be eligible for these jobs. And it's this amazing dashboard that really it's kind of filling in the gaps for the job seeker, if you will. And I saw that dashboard and just thought, wow, California is so far from that, right? But why can't we at least pursue that, right? And just really, because if you think about our whole life is right now controlled by dashboards, right? We look at air quality, we're looking at COVID, we look everything from our finances, and it's like, but when it comes to a job seeker, it's super confusing, especially in healthcare. What are the credentials that I need to get that job, right? And the other piece of this is these technical jobs, which are maybe you're not a nurse, but you're still in the field, you're still working in the hospital. Those are
Allied health.
Good paying jobs, allied health, right? And we teach a number of those. We have a number of those at Cal State East Bay through my extended education operation. And they're fully online, they're accessible, and the return on investment is fantastic, right? It might be $2,500 to get your certificate in medical billing, but outside of that, once you finish that, you're ready for a job, and there's just a huge demand for those individuals out there. So I think has a little bit to do with marketing, but I also think it has more to do with this system of let's put the inputs and outputs together and make it easier. So I'll send that to you post this meeting.
I would really appreciate that. And Brian, just out of curiosity, is there any situations in which high school students ever receive CSU credit as opposed to community college credit? And if so, is that something you've ever explored with like an extended education program, like a medical billing class?
So the answer is yes, and not enough. So the answer is yes, it's set up for that super high achieving high school student who has all of that parental support, and who's going to help them through the process and sort of beg and plead through the administration. Because of course it's set up for we're post, GED, if you will. But to your point, there are institutions. The University of Washington does a really good job with this. They actually are really out there marketing to the high schools and have these pathway and summer programs and so on and so forth, which I think is phenomenal, because really what you're doing is branding your institution as this is the place you're going to, right? Whereas, I mean, I'll be honest, our particular situation is, we're here, come if you'd like. And, let's just keep that between us friends. I do think that we could certainly have a much more aggressive and sort of relationship and pathway with the high schools. But as Heather knows, Cal State East Bay is more of a transfer institution. We have a very small freshman population. The freshmen are going to the community colleges, and so we're much more focused on supporting transfer students and graduate students. And so that's a challenge, right? You have to put a lot, you put a lot of resources into that freshman integration, right? And now we have our freshmen who typically live in our dorms who are not living in our dorms right now, right? So there is this massive loss of, so that's not where the near term energy is going to put. We really want to retain our transfer students and get them to graduate. So student success is really at that point. But that's not to say we cannot carve out at least an initiative, maybe specifically in that for healthcare and healthcare students, majors specific at the high school. So that's a good idea.
Thank you, Brian. This gives us some things to think about for sure. And Tamika, we're about to close these out in about 30 seconds, but I'm curious, do you know if you and your organization publish any information about kind of growth in the allied health field, like where you guys project growth?
I do not know, but I can find out.
That would be wonderful. If you wouldn't mind, that would be really great. Okay, well, my inclination is that I'd love to keep talking to you guys about these things, and gals, I feel like we've come up with some interesting things to continue to explore. So that's going to be my recommendation, that we might benefit from another meeting in which we meet in small groups. Does anyone have any disagreement with that? Okay.
You did it, Lindy. You got everybody back. Yay.
Thank you, everyone.
So just with the few minutes that we have left, I don't know that we'll get to hear, or I don't know if every group does want to report out in terms of, key highlights of the discussion, some action steps, and potentially whether you want to keep meeting or not. We definitely want all of your notes. Please email those to Laura. But I would love to get some report outs if folks are willing. Is there anybody that wants to any group that wants to speak first? Donna.
Yes, we had a very exciting meeting, and I am so excited about the interest in this. And what we came up with is really, we need to do a better job of marketing and outreach and explaining what it is we have to offer. And so that's our next mission, is developing some marketing, some tools. Yes.
What group are you?
Oh, I'm sorry. Thanks, Pam. So we are talking about the subsidized employment, OJT and subsidized employment. Thank you. So yeah, we are on a mission. We want to make sure that people understand what we have to offer, get to businesses, and make sure that they know we are not always that horrible and complicated to work with as a government entity. We can make this easier for people.
All right. You're fired up. I love it. That's great. Is there another group that wants to go? Can I impose on Vic Baker to talk about funding priorities a little bit? Vic?
Absolutely. Hi, everyone. So our group met to talk about funding opportunities, and we really want to focus on if somebody were to provide some funding, whether it's private or public funding, where should that funding go? How can we help small businesses get off their feet or meet the needs of the community who've been affected adversely by COVID-19 and the current situations? And so I think Jim Becker really helped out in providing some understanding and putting in the bucket some areas that we can really focus on. And those buckets would be small business, and the safety around small businesses and helping organizations and small businesses perform safety measures within their organization. For our retail, that may mean put shields up and things of that sort. And so can we help fund small businesses in helping with their safety measures? Also, rental assistance. While we have rental assistance that's available now for our residents, how about rental assistance for small businesses? If that's an opportunity there. And then some adjustments to new norms. I was asking a question, what's a new norm? And I think it was very well articulated that a new norm could be a model shift, how businesses are changing the way that they do business in response to COVID-19 that actually may do better for them as opposed to their how they've been doing business so far. And then continuing with that a contingency plan and financial planning in preparation for something like this will happen. So I think where we're focusing on now is where could we potentially, if someone were to come and offer us some money, where could we put that $100,000 or that $500,000 and help them to decide what part of what bucket to put that in that'll best serve their needs.
Thank you. Okay, I'm turning to the group that's supporting the local industrial base. Do we have someone who wants to speak to that? Pam, you're smiling, you're pointing. Who's pointing back and forth at each other?
Trying to get Lindsay to do the report out. Okay. Yeah, so we had a really good conversation, but at the end of the conversation, actually, I must admit that we're not, I guess we maybe need a tighter scope in terms of just clarity. Are you looking for us to create like a marketing campaign that brings industry to the county, or we kind of looked at it a little bit more holistically in terms of creating a roadmap? We want to get a really clear state of like the current state of what is everything we've got to support industry, from education through the workforce development to the types of industries we've got here to future high growth industries. Map that out and then really kind of focus in on areas we have weaknesses where we can start to think about what would be the programs to shore that up. Or like I said, or is our group really just about like, here's why you want to do business in Contra Costa, come move your business here?
I think that in terms of the scope, it was sort of the first one in terms of a broader, bigger thing. Rather now a marketing campaign could be an important piece of that. You know, that could be one of the offshoots of the work. But in terms of, you know, I would hope that you could look to us to say, hey, identify these, like, these are some things we need to know more about as we develop this broader plan. So yeah, let's keep talking. I'm mindful of the clock. I don't know if there are other groups that did want to talk. Broadband, Ken, you just unmuted.
Yeah, I'll just say real quick, I really appreciate the opportunity to talk about the broadband access issue. And while access is really important, I think what we really came to is the need for education at all levels. One of the things we were talking about was small business, for instance. With the move to COVID, a lot of businesses that were just basically walk-up businesses now had to develop websites that included, you know, putting their menus online and ordering and being able to establish pickup routines and things like that. But a lot of it was based upon them not having the technical capability, while even the access might have been available to them, just knowing how to do it. So we talked about programs like Concord First program in the city of Concord that dealt with a lot of permitting issues and things, but maybe expanding those kind of programs to include technology education. And then also for consumers, particularly seniors, who again, may not even know that they have the capability at their fingertips because they don't even know how to turn on the tablet that they may have gotten from their grandkids, for instance. And how do we expand educational opportunities to make use of what's already out there, in addition to how do we expand the technology base itself?
Great. Yeah, no, there's definitely been exciting and important developments in broadband, and want to make sure we're capturing those gains locally. Lindy, what happened in healthcare?
So we had a great discussion, and I think came out of it feeling like we could keep talking about these things. So that was kind of our end reflection. But we, I think, really touched on some possible points of advocacy, both at the community college, maybe more directly, but also thinking about how we might bridge the K through 12 system and the CSU system even, and thinking about allied health and access to allied health. And we talked a little bit about telehealth as well. So we actually talked about a lot in a short period of time. I really appreciated my group and all the input.
Excellent. I think that was all 5. Did I miss anybody? Any group? Okay, so what we're going to do is make sure that we get all the notes from each group, put together kind of a status update about where we're at, and be a little bit more proactive about updating you via email between meetings. And as you know, both the county staff that are supporting this effort as well as the CCEP team, we're going to do our best to move this down the football field as best we can between meetings. So I did want to just note that our next meeting will be in the 4th Wednesday of October, which is October 28th. And so we'll meet between 9 and 10. It feels like it'll be a very long, month between now and then. I feel like a lot has to happen. Hopefully Contra Costa moves to the red tier. Hopefully there's forward progress on schools reopening in person. Hopefully there's a lot. Hopefully we can still have blue, clear sky, and that we are not dealing with another fire emergency. So I know Vic is going to take it seriously to keep our lights on at PG&E, and I definitely just wish you all the best with everything that we are all navigating. And thank you for your continued engagement. You help us be smarter about this with every meeting. So thanks very much. Take good care.
Hey, thank you for your leadership, Kristen. Appreciate you.
Oh, thanks, Vic.
All right. Take care.